This Be More Lifestyle segment is sponsored by Orthopedics Associates of Central Maryland.
Hello from the Orthopedic Associates of Central Maryland. I am here with Dr. Polsky. We are going to learn about rotator cuff and rotator cuff injuries. Thank you for having us out.
My pleasure.
Starting with square one, what is a rotator cuff?
Good question. Common misunderstanding, rotator cuff is actually a structure that's made of 4 tendons. So the lesson is muscles turn into tendons, tendons attach to bones and help them move. So the rotator cuff is dynamic. It helps the shoulder move and rotate. That's why it has the name rotator cuff, but it's actually made of 4 tendons.
I think we think of this, a lot of folks might think of this as sort of you hear about this with baseball players, and certainly in sports. How do these injuries come to be typically?
A couple of different ways. So certainly you can get a rotator cuff injury traumatically. Fall, arm out, or accidents can also cause rotator cuff injuries. The other common is repetitive actions. So like pitching, throwing, climbing, even like painting a ceiling for hours at a time can potentially cause a rotator cuff injury.
Symptoms, sort of pain may be too obvious, but what do folks experience if they may have one of these injuries?
Yeah, so classic ones, certainly pain out of proportion to normal. So something that's painful enough to stop you from normal daily activities, right? Loss of motion can be a sign where I can't get above a certain area, and it wasn't like this last week. Weakness, can't lift my arm. Those are a little more dramatic, but if it's something changed and you can't lift your arm, that's something to get evaluated. And then pain with motion. So I don't hurt here, but if I do something where I rotate a certain way and it hurts, that could be a sign.
The treatment of this, what does that entail?
So it depends on the diagnosis. So rotator cuff injuries can, run the gamut from minor strain and tendonitis, inflammatory things, to sprains and tears and ruptures, okay? Early on, it can be treated with simple things like activity modification, stop doing what's hurting it,
Sure.
right? Anti-inflammatories, exercises, okay? Those are the simple ones. Icing, and then all the way to other modalities like prescription strength medications, cortisone injections can be helpful for certain types of diagnosis, and then all the way to surgery if something's ruptured or not getting better for some reason.
Should folks need surgery, what does that sort of timeline look like?
Yeah, it depends on the exact diagnosis and the procedure that's being performed. And there, rotator cuff surgery is not one thing. It can be a repair, it can be a partial repair, it can be a debridement, which is cleaning up. So to answer the question, it can vary from even a 4 to 6 week recovery, really to a 4 to 6 month recovery.
For folks watching who may have one of these injuries, or a loved one or a family who may have one of these injuries, where can they go to learn more?
mdbonedocs.com or 410-644-1880.
Dr. Polsky, thank you so much.
My pleasure.
All the best.
Yeah, thank you.